All right, today we are decoding the future of health. We're going to take a tour through some of the biggest, most groundbreaking ideas that are completely reshaping modern medicine. I mean, everything from your doctor's office all the way to the research lab. So, yeah, let's just dive right in. Here's a question that I think affects every single one of us. You read about some huge breakthrough, right? A new treatment, a new way of understanding a disease. But then it just seems to take forever to actually show up in your doctor's office. So what's causing that huge delay? And, more importantly, what are we going to do to fix it? Well, that exact problem is what a platform called healthtopic.org is trying to tackle. I mean, their entire mission is right there, to bridge science and practice for a healthier future. So for this explainer, we're going to use their research as our map, really, to see how that's actually happening on the ground. So let's do it. Let's take that guided tour. We're going to explore the key themes that are really at the heart of this whole transformation. We'll look at the tech, the data, and of course, the human side of medicine to see how these brilliant ideas are finally making it into the real world. Okay, first stop on our tour, the digital doctor's bag. And look, this is way more than just, swapping out a stethoscope for a tablet. We're talking about a really fundamental shift in how our medical pros are trained and how they deliver care day in and day out. So what's in this digital bag? Well, it's packed with some seriously powerful new tools. For training, we've got virtual patients. For research, there's AI, of course. For the day-to-day grind, nurses are getting new digital learning resources. And you've even got entire countries connecting their doctors through shared digital health records, like the e-Naba system in Turkey. Let's start with this one because it's just an incredible idea. Virtual patients. Just imagine this. Before a future physician assistant or a doctor has to have that really tough conversation or make a high-stakes diagnosis on a real person, they get to practice on these incredibly realistic digital avatars. It gives them a safe, repeatable space to really sharpen their skills. But what's really interesting is that the researchers behind these tools, folks like Sharona Kanofsky and her colleagues, they're asking the hard questions. They're looking into whether students are actually learning the skills they need, or if they're just kind of gaming the system to get through a simulation. And that self-criticism, that's absolutely key to making sure these tools are actually effective and not just, fancy tech. Okay, let's move on to our next stop because it all connects. All this new technology, it's creating this absolute tidal wave of data. So the next huge challenge is how do we turn all of that information, all that noise, into a genuinely powerful diagnostic tool? I mean, just think about it for a second. Every single year, millions of new medical studies get published. Millions. So how on earth is one doctor or one researcher or even a policymaker supposed to keep up with all that? How do they spot the really important trends and connections that are buried in that mountain of information? Well, the answer is a field called bibliometrics. And you can think of it like a GPS for scientific knowledge. It's not reading every single study, but it's using statistical methods to map out entire fields of research. It shows you who's working on what, where the real hotspots of innovation are, and maybe, most importantly, where the gaps are. So, for example, by using bibliometrics, researchers can get this amazing bird's-eye view of, say, all the research happening on bioethics in a specific country. Or, like in another study, they can sift through those mountains of data to pinpoint the key social risks that affect kids with type 1 diabetes. It's a tool that basically makes invisible patterns visible. And this kind of approach is also absolutely crucial for artificial intelligence. One of the articles on the site breaks down how researchers build accurate AI models. It's basically a three-step process. First, they gather these massive data sets. Then they use machine learning to find the hidden patterns inside. And then, and this is the really important part, they select only the most critical factors to build a sharp, focused, and effective predictive model. And all of this brings us to our third and, maybe the most important stop on our tour, and that's focusing on the human. Because with all this talk about amazing technology and huge data, at the end of the day, healthcare is, and it always will be, fundamentally about people. So this part of the tour is all about the human skills that power the medicine. We're talking about training doctors to communicate better as a team, understanding how our social connections actually impact our health, and even encouraging a kind of entrepreneurial spirit to find brand new ways to keep patients safe. And this really points to a major shift in how we're training doctors. So instead of the old way, just sitting alone, memorizing facts, a method called team-based learning actually puts students into groups to solve really complex problems together. And this teaches them so much more than just medicine. It builds those crucial collaboration and communication skills that they're going to need for their entire careers. And this human element, it goes way beyond the clinic's walls. Another huge area of focus is something called social capital. Basically, it's the idea that our health is deeply, profoundly affected by the strength of our relationships, the trust we have in our community, and our social networks. It's just a powerful reminder that health isn't just made in hospitals. It's made in our homes and in our neighborhoods. So where is all this headed? For our final stop, let's pull all these threads together. Because the technology, the data, and the human element, they don't exist in separate bubbles. The real future of healthcare is all about how they connect, how they integrate with each other. If there's one thing to take away from this whole tour, it's this. The future of medicine isn't just about a better app or a bigger data set or even a kinder doctor on their own. The real, lasting breakthrough comes from putting all three together. It's about how they connect and actually empower one another. So ultimately, the future of health isn't about picking one priority over the others. The digital doctor's bag, data as a diagnostic tool, and the human element, they're all equal partners here. They are three totally essential parts of a single, much stronger system. And that's what leads to better outcomes for all of us. And that brings us right back to where we started. By weaving together the cutting-edge tech, the smart data analysis, and a really deep focus on human interaction and skill, we can finally bridge that gap between a brilliant scientific discovery and the actual care that you get every day. So as we wrap up our tour, I'm going to leave you with a question to chew on. Looking at all these pieces, the tech, the data, the human side, what is the single biggest change you want to see happen in healthcare? Because your answer to that, well, that's probably where the next breakthrough really begins.